Welcome to American Medicine Today. I'm Kimberly Bonati alongside Ethan Euchre and world-renowned orthopedic surgeon Dr. Alfred Bonati. Exciting show lined up. Let's get straight to it. An award-winning journalist and investigative reporter at Newsweek knows all too well about the difficulties of having a child and takes a deep dive into fertility and the quest to become a single mother by choice in her new book. Please welcome Valerie Bauman to the show, author of Inconceivable. Thank you for joining us, Valerie.
Hi, thank you so much for having me.
Certainly. So what made you interested in exploring this particular topic?
Well, I was 38 in the middle of a pandemic. You're thinking about your mortality, your legacy, and I realized I wanted to become a mom. I didn't have a partner. And I very quickly grew disenchanted with sperm bank websites. I wanted to give my kid more answers than they could find just on these websites. And I stumbled across a world I call the world of freelance sperm donation. It is a bizarre Wild West where men help women and LGBTQ couples and some heterosexual couples reproduce by providing their sperm. It's a very bizarre scenario, but for me, it ended up working out really beautifully. I'm currently almost 9 months pregnant. And I just knew it was a story I had to tell. I had never heard of anything like this in my life. And I've been a journalist for 20 years and my storyteller instincts were just set aflame.
Very interesting. So, how did you discover it and what was that journey like in finding the eventual donor of yours?
Well, I basically started out with the sperm bank websites and I was making spreadsheets and trying to prioritize, but everything just seemed so shallow. At the end of the day, do I care about my kid's eye color or do I care that someday when they meet the donor who helped me create them, that it will be a kind and good person that, has a patient and genuine temperament. I wanted to really be able to get at who these men really were when I made my decision. So I literally just Googled sperm donor that you know. And I started exploring. There's websites, there's an app called Just a Baby. It's like Tinder for getting knocked up. You just swipe until you find somebody that you match with. I had my success using the Facebook groups, of which there are many. A lot of men who are producing dozens and dozens of children, which would leave my child with countless half siblings. And I think that donor conceived people deserve to know both where they came from, the donor that helped their parent reproduce, but also their biological family, their half siblings.
Aren't there parameters put on how often, how many times a male can donate? And then also there's the whole paternity of it all. What do you know about all of that stuff?
Well, that's a great question. Sperm banks and the fertility industry have actively lobbied against any laws that would place formal limits on donations through sperm banks. Instead, sperm banks say they have these self-imposed limits, which I believe it's roughly 25 children produced per donor per 800,000, population of 800,000. So that could easily in the United States result in, hundreds of children. And then the sperm banks start trading their vials internationally, and the number of children grows exponentially. The United States legal system is loath, for understandable reasons, to place any limit on how many children any person can produce. It gets into a really tricky area of bioethics, but because how do you draw that line to say, no, you're not allowed to create any more children, or you can only create children with this many people? While it's may logically kind of instinctively make sense, it gets into kind of an icky territory for, it's a weird way to put it. But yeah, it's a little icky to try and tell somebody you're not allowed to have any more kids.
How do you keep the creeps away that are kind of trying to prey on individuals wanting a child?
There are a lot. It takes time, patience, and vetting. I had a list of, roughly 25 just initial questions. So you do have to wade through the creeps and the perverts. I had one sperm donor who's a moderator for, at least 6 or 7 different groups, estimate that 80% of the men who are in their sperm donor groups are only willing to donate via sex. A lot of these men coerce and pressure women into sex. And even when they aren't, some of them do get an erotic thrill out of knowing they're getting somebody pregnant. And so It's a matter of taking your time, getting to know somebody, not rushing into the process, and understanding the motivation.
What is in it for the donor? What are they getting out of it? Because I'm sure when I think of a sperm donor, I think of somebody who probably needs a few bucks and is, selling it off to the bank and just wants to remain anonymous. So what's their motivation?
The answer that makes the most sense to me that I can get comfortable with is there are men out there who have a biological imperative to procreate beyond what is reasonable for their immediate family and financial situation. They maybe have had 1 or 2 kids. They want more, but their wife isn't on board, and they want to, through this, inexplainable urge, continue reproducing. And they also, a lot of these men have met lesbian women who become friends who want to be able to have a baby. And they had a kind of come to Jesus moment where they thought, I can help this person. Sperm banks charge so much money. And what people don't realize is when you get sperm from a sperm bank, not only is it frozen, which means it only lasts in your body up to 24 hours versus up to 5 days with fresh sperm, but you're also only getting a fraction of the actual deposit made by the donor. Sometimes they chop it up into 8, 10 different separate vials. So you're paying, $1,000, $1,500 plus shipping for a vial of sperm that is a fraction of the actual emission.
That's insane.
Well, thank you so much for being on the program, Valerie Bauman, to the show, author of Inconceivable. And again, congratulations on your journey and your upcoming baby.
Yes.
Thank you so much for having me.
Stay tuned. We'll have more after the break. You're watching American Medicine Today.
The loss of coordination in my legs, I'd trip over my feet, end up flat in the concrete. Dr. Bonati to me was God sent. Look like that in a while. I don't remember how long. I didn't have to make a massive lifestyle change. I noticed today that I could sit and stand up without a cane. I would have to give it excellent and above my expectations.
Visit AskBonati.com. Deborah is an active woman that enjoys spending time with her friends and family.
Since 2014, I have been in chronic pain. I have no life. I wasn't able to enjoy the things that I used to. I don't know what brought it on. It was just, I started having pain. It was in my low back and went into my butt cheeks, the inner thigh, outer thighs. I had throbbing, burning, stabbing. From one end of the spectrum to the other, I experienced that pain. It prevents me from walking, sitting, or standing for any length of time. I would walk with a walker and sometimes without a walker. It just depended on the day.
Initially, she sought help from conservative treatments.
I saw my primary care physician, and she put me on a steroid. 2 weeks later, I'm back in her office. I didn't get any relief from the steroid treatment. So then she gave me some shots. She had diagnosed me as having trochanterous bursitis, and I got multiple shots in that area with no relief. I saw 16 different specialists. I went to 3 different pain clinics, and I had multiple physical therapy. And the physical therapy actually made everything so much worse. It aggravated it. And when I would come home from physical therapy, I was in bed.
When nothing provided relief, she was diagnosed with an annular tear in June of 2020 and underwent a spinal fusion at the Mayo Clinic.
The surgery didn't give me any relief. I had the same identical symptoms that I had before I had surgery. They had me wear a pain patch. I wore the patch for probably 2 months and told the doctor, this patch is not working for me. I was just like, nope, I am tired of going to all the physicians in my local area and not getting any relief whatsoever.
After fusion surgery failed to alleviate her pain, Deborah wasn't sure what else she could do.
And then I started going into the Facebook page for Bonati, went on YouTube, and listened to other testimonies from other patients that have been treated here. I was tearing up because I thought, oh my gosh, this person has the same issues that I have, and that they were able to help that patient.
With renewed hope, Deborah contacted the Bonati Spine Institute and sent her MRIs in for review. Dr. Bonati called her personally to discuss her case and told her she would be a good candidate for his procedures.
When Dr. Bonati, said I was a candidate, I was very excited. But then, because of my past experience at a spine institute, I had my doubts. When I got here, they said they could help me.
The exclusive Bonati Spine procedures are performed using Conscious IV Sedation, where the patient remains awake and interactive with their surgeon. This technique is used to ensure the source of their pain is eliminated.
It was pretty nice because I did have concerns. I don't want to be awake during the surgery. So the surgical experience was wonderful. I had immediately relief, and I was overjoyed.
Any pain going down your legs or your butt? No, nothing in the front or the side? Wonderful. Okay.
After surgery at the Bonati Spine Institute, patients are encouraged to walk a few times a day to aid their body in the healing process.
They recommended that I do therapy at home, walking about 20 minutes a day, and gradually increase as I can tolerate. And I'm to do stretches because you can develop scar tissue, and that's with any surgical procedure.
Now on her way to living a pain-free life, Deborah is looking forward to spending time once again with friends and family.
Going on a walk with my husband and my dog. He walks our little dachshund every weekend, and he does at least 3 miles.
Deborah highly recommends the Bonati Spine Institute to anyone suffering with neck or back pain.
I am so thrilled that I've gotten relief. Come to Bonati Spine. You will be very pleased.
To see more stories of recovery just like this, search for the Bonati Spine Institute on YouTube, Rumble, Roku, Amazon's Fire TV, Google Play Store, and Apple's App Store. Welcome back to American Medicine Today. Dr. Bonati and I are going to talk about the benefits of Conscious IV Sedation. So, Dr. Bonati, you've been implementing Conscious IV Sedation within the Bonati Spine Procedures for decades. Why is that better than, say, something like general anesthesia?
There are too many things on the patient that they require to be able to do a surgical procedure and prepare that patient to a situation that can be treated well. Mm-hmm. Initially, our problem was that the patient was too heavy. Mm-hmm. So we told patients, you need to lose weight. Mm-hmm. My patient was 400 pounds. People who has or had back pain will tell you that is so incredible traumatic, not only because of the pain, but the limitations that that pain is going to give it to you, that practically you cannot move.
Right.
So you're asking somebody of 400 pounds to lose 200 pounds of weight. Mm-hmm. That's not going to happen. Other thing that also was when I practiced, I saw patients that they said, you need to have clear this patient for the surgery because this patient has a heart condition. So now we need to have a fight with the cardiologist that this patient needs to be operated, but the cardiologist has his own views of how this patient needs to be treated and how this patient now can be cleared for surgery or not. So a lot of those patients were discarded for surgery because the cardiovascular situation impaired this patient to have a general anesthesia.
Right.
I start to put in my mind how I am going to treat the back without really making a lot of this group of people out of the practice because I need to put the patient to sleep. Because I was lucky enough to be involved at the university using arthroscopes for knee problems.
Yeah.
We start initially thinking that I need to put those tubes on the back. I maybe need to just put some type of a local anesthesia. And if I numb the skin, probably I will be able to enter the area. But the fascia was very painful.
Right.
And the muscles were painful. And the bones have pain. So in my mind was, I would torture a patient if I do that.
Yeah.
I can put the tube, but once I do that, I would not be able to operate the patient because all these structures around me, they will be with a lot of pain. So I have an anesthesiologist friend who always cooperated with me. And he said to me, look, we don't need to put the patient to sleep. What we can do is numb the areas that you consider that is a problem. So what we did is we put the tubes and we numbed the area. Just put some silocaine in the area. The problem was the patient didn't have pain, but the nerves were numb. So I never knew if the patient will be better or will not.
Right.
That procedure, although give us the first intention to how do the conscious sedation,
Right.
but we will have a live area inside that will impair for us to evaluate the patient's result.
Right. We're going to take a quick break and be right back with you talking about conscious IV sedation. You're watching American Medicine Today.
I think everybody was shocked, like, really, you had surgery today? I had a drain tube. I was at my desk doing payroll for 200 employees, worked till night, got up, went to bed.
Actually, the recovery was great. I mean, I really immediately felt the difference. I was able to go back to work within a couple of days.
The progress after each procedure was amazingly good. The recovery all told has been phenomenal.
We went to the Bonati Institute, and that was the day, the turning point in my life. This type of surgery is so much more advanced, and the recovery time is so much less that it's just a no-brainer. If you've got pain, go to Bonati.
The surgeries that I had, actually, I recovered very easily from, I would say. I actually went to work the following afternoon.
6 days after surgery, I was back in the gym, slowly but surely working my way back to fighting, back to basically 100% of fighting, you know? So 6 days, and everybody was in awe, like, didn't you just get out of surgery? I'm like, yeah, I feel great. And like, okay, let's see how you do. And I was bowling with everybody, and I'm in the advanced class. So that sounds a lot right there.
First time I came in here was Monday, and today is Thursday. I've had 2 surgeries and am doing fantastic. I'm still in shock that I can walk. That's all within 4 days.
Bonati succeeds where others fail. Welcome back to American Medicine Today. We're continuing the discussion on conscious IV sedation. You know, being the patient myself who's been on the operating table where I've been fully awake, anesthetized enough so that I'm not in pain, but fully functional, and you can feel pressure on the nerves, and at times there's some discomfort, but it's nothing excruciating, and you're able to pinpoint the exact root cause of the pain.
Putting my mind that if I do it, if I create a telescopic tube and I can move those tubes as a target exactly to the area that I need to operate, I minimize the damage. The tubes will control some of the pain on the tissue because I can put some type of rub some anesthetic on the tubes that they will just touch the areas of the muscle that can be sensitive.
Right.
But I still have problems. What's going to happen if I put a drill in the bone?
Right.
So talked to the anesthesiologist, and between the conversation and the decision, he said, let's sedate the patient.
Yes.
And to our surprise, the sedation of the patient allowed us not only to introduce the tubes, to bypass all the tissues that were dormant at that time, and they create pain. And to my surprise, when we use materials to work on the bone, the bone didn't really hurt. What shocked the hell of me, because I thought that the bone would be the major problem.
That's what really makes the Bonati Spine Procedures so effective and brings about that 98.75% patient-reported satisfaction. So thank you for delving into kind of how you came to create that and invent the notion of conscious IV sedation. And it truly is for the benefit of the patient. That's all the time we have for this show. Join us again next week here on American Medicine Today. And if you would like to see other episodes, add us to your channel streaming lineup. Search American Medicine Today. If you have any comments or questions, contact us at the numbers below. Or you can tweet at Dr. Bonati using the hashtag American Medicine Today or hashtag AMT. We would like to hear from you.